Welcome back. So if you knew that a vaccine could prevent cancer, would you be interested? That is exactly the case with preventing some cancers in men and women. What do you need to know about the HPV vaccine? Joining us this morning is Dr. Julie Goodwin, an OB/GYN with Baptist Health, with some great tips for us. Dr. Goodwin, thank you so much for being here. So for people who are watching, what exactly is HPV and how is it spread?
So HPV is human papillomavirus. It's the most common sexually transmitted infection in the United States. We estimate that nearly every sexually active American will have at least one strain in their lifetime. It's spread through any form of sexual contact, even through skin-to-skin contact. Normally, the body can clear it within a few years, but if it doesn't clear and it's a high-risk strain, it can persist and become a form of cancer. The last month was National Cancer Prevention Month, and since HPV is the leading cause of cervical cancer, and it can be prevented through a vaccine, we essentially could prevent cervical cancer through this vaccine alone.
You know, some parents, I hear, they may have an issue with, their child getting the HPV vaccine because they're not sexually active or they're really young. What do you say to parents or people out there who are just on the fence about this vaccine that is not mandated but is sort of recommended?
Yep, I always say that's great that they're not sexually active. That's the ideal time to get it. This vaccine is most effective if it's given before sexual activity. In fact, it's 99% effective at preventing HPV-related genital warts and cancers when all the series is given and it's given before sexual activity. It's one of the most effective vaccines that you can receive. So I wish it was mandated, but it's not. But we essentially could eradicate cervical cancer and some other cancers if this was a mandated vaccine.
So are there other ways to prevent cervical cancer besides just the vaccine?
So there's ways to help minimize it, but not necessarily prevent it. Condoms help to reduce transmission, but not fully prevent it. And then you can help your body to clear the virus, but again, not prevent it, just by keeping your immune system well. So not smoking or vaping. Keeping your immune system up, so eating well, exercising, and then for women, getting your routine PAP and HPV test. It doesn't, again, prevent abnormal cells, but it helps us to know as the gynecologist when we might need to intervene on any abnormal. So if you have an abnormal, definitely follow up. If it's negative, though, you may not need a PAP every year, but you do need an exam every year.
Are there any side effects to the vaccine? A lot of people, they don't want vaccines because of the side effects.
So with this one, really, it's injection site pain or soreness, swelling, and potential headache. But millions of people have received this vaccine without any serious adverse side effects.
All right. Well, Dr. Goodwin, thank you so much for your time this morning. And if you would like to reach out to Dr. Goodwin, you can do so by contacting BaptistHealth.com or calling the Baptist Health line at 1-888-BAPTIST.